President Biden has been diagnosed with prostate cancer with metastasis to the bone. That's according to...
Now, former President Joe Biden has been diagnosed with prostate cancer. A statement from the personal office of the former...
When the former president of the United States, arguably the most watched man on the planet, quietly confirms a prostate cancer diagnosis, it's not just another health update. It becomes a national mirror. A painful spotlight. A wake-up call for every man over 60, and for every family who's ever lost someone to something preventable. Joe Biden's battle with prostate cancer isn't just his, it's ours too. It pulls back the curtain on a disease that affects millions, yet remains spoken of in hushed tones, if at all. Let's be honest, most men don't want to talk about their health. They especially don't want to talk about this kind of health. It's personal. Embarrassing, even. But when someone like former President Biden goes through it, it forces the conversation into the open. It challenges the silence. And it makes us all ask, if it can happen to him, what about me? What about the men I care about? What makes this moment so powerful is that it reveals just how widespread, under-discussed, and dangerously delayed prostate cancer diagnoses can be. With over 1 in 8 men in the US developing it at some point, and over 34,000 dying each year, it's not rare. It's not distant. It's here. And it's deadly when ignored. Yet, despite these stats, many men still don't get screened until it's too late. They skip doctor visits, avoid conversations, and downplay symptoms. Because admitting there's a problem feels like admitting weakness. Joe Biden, by publicly acknowledging his diagnosis, did something many men never do, he faced it head-on. Not with fear, but with quiet strength. He didn't dramatize it. He didn't seek sympathy. He simply confirmed it, and continued on. That choice, that moment, has the power to save lives. It shows that health is not a weakness, it's leadership. And that's exactly why this video matters. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Before we dive deeper into what President Biden's diagnosis could mean for the nation, it's crucial we understand the fundamentals, because prostate cancer, despite being so common, is still poorly understood by the men most at risk. So, let's break it down. No fluff. No jargon. The prostate is a small, walnut-shaped gland located just below the bladder in men. It produces seminal fluid that nourishes and transports sperm. As men age, this gland can become a site for abnormal cell growth. And when those cells grow uncontrollably, that's prostate cancer. Now here's the kicker, early-stage prostate cancer usually doesn't cause noticeable symptoms. That's why it's often called the silent killer. You can be going about your life, working, golfing, spending time with family, completely unaware that something deadly is brewing inside. And when symptoms do appear, difficulty urinating, blood in the urine or semen, pain in the hips or back, they often indicate the cancer has already progressed. That's what makes screening so important. There are 2 main tests, the PSA blood test and the digital rectal exam. Neither is perfect. Both have been debated. But when used properly, especially in men over 50 or with a family history, they can be life-saving. So why do so many men skip them? It's partly pride, partly fear, and partly misinformation. Some worry about unnecessary treatments. Others don't want to deal with the uncomfortable nature of the tests. But doing nothing? That's the real risk. That's the silence that kills. Joe Biden is 81. His diagnosis puts him statistically at one of the highest risk age groups. But here's the difference, he caught it. And chances are, he caught it early. Because presidents get regular screenings. They don't skip checkups. They have doctors who insist. Most American men don't have that kind of access, or urgency. But maybe they should. Because when someone as high profile as the president gets diagnosed, it can force millions to pause and think, should I be checked too? That pause could save your life. And this is where things get serious. The problem isn't just the disease. It's the silence around it. The misunderstanding. The delay. The reluctance to talk about uncomfortable but crucial issues. That's what we need to change. And that change starts with knowledge. It starts with watching this video. And it starts with you. Let's get honest for a second. When was the last time you, or the men you know, went to the doctor for a routine checkup, not because something was wrong, but just to be proactive? If you're hesitating to answer that, you're not alone. Across America, men are dying younger, not because the technology isn't there to help them live longer, but because they're not using it. And prostate cancer is just one piece of a much larger crisis. Men's health in America is in trouble. We're talking higher death rates from preventable diseases. Heart disease, diabetes, and yes, cancers like prostate and colorectal, are claiming lives every year that could be saved with early detection. On top of that, mental health challenges like depression and anxiety go unchecked, leading to tragic outcomes like suicide, especially in men over 50. Now ask yourself, why? Part of it is cultural. Many men grow up believing they need to tough it out, to be strong and silent, to push through the pain and keep going. They're taught that seeking help is weakness. But here's the truth, ignoring your health doesn't make you strong. It puts your life, and the people who depend on you, at risk. Joe Biden's diagnosis has the potential to change that narrative. When the President of the United States, a symbol of power and leadership, faces a health challenge head-on and talks about it, it sends a powerful message: getting screened isn't weakness. It's wisdom. It's responsibility. You see, when a high-profile figure like Biden gets diagnosed, it doesn't just make headlines, it makes people listen. It sparks dinner table conversations. It gets dads and sons talking. It even motivates men who've been putting off their checkups to finally call their doctor. And in a country where men are 24% less likely than women to visit the doctor regularly, that shift matters. But let's be clear, this isn't just about awareness. It's about action. Because every day, another man ignores his body's warning signs. Every day, someone dies from something that could have been treated. And every day we don't talk about it, the crisis grows. That's why we're making this video. Not just to report on Biden's health, but to use it as a wake-up call. A turning point. Because this is bigger than politics. This is about life. Your life. Joe Biden's prostate cancer diagnosis didn't just make news, it made waves. In a political landscape that's often more focused on sound bites than substance, Biden's health announcement triggered something rare, a deeply personal, national conversation about men's health. And it's about time. For too long, discussions around prostate cancer have stayed in the shadows. Despite the fact that it's the second most common cancer among men in the United States, public discourse has been minimal, hushed, or framed with discomfort. But when the leader of the free world reveals he's been diagnosed, silence is no longer an option. Suddenly, media outlets that rarely mention prostate screenings were dedicating entire segments to them. Doctors were being interviewed during prime time. Health organizations launched fresh campaigns overnight. And men who normally avoid talking about their health, were finally asking questions. That's the power of public influence. What makes Biden's case particularly powerful is his age. At 81, he represents a demographic that's often overlooked in conversations about preventative health. Men over 60, especially those over 70, are frequently written off as too late or too old to benefit from new treatments or early screenings. But Biden's openness showed that it's never too late to take your health seriously, and that doing so can have national impact. In fact, according to recent data from the American Cancer Society, web searches for prostate screening and PSA test spiked following the announcement. Clinics in several states even reported a noticeable uptick in calls about prostate exams. That's real change. And it's happening in real time. But the ripple effect doesn't stop with individuals. Biden's diagnosis has also lit a fire under health policy advocates. Calls for more accessible screenings, especially for lower-income and rural populations, are getting louder. Insurance companies are under pressure to make PSA tests more affordable and routine. Lawmakers are being pushed to re-examine federal funding for men's health initiatives that have long been under-prioritized. It's proof that public figures, when transparent about their health, can shift national priorities. And let's be honest, this shift couldn't come at a better time. After years of declining life expectancy and a pandemic that revealed massive gaps in our healthcare system, America is hungry for reform. Hungry for leadership. Hungry for the kind of conversation that leads to action. So whether you're a man in your 60s, a son worried about his father, or someone who simply cares about the health of our communities, this is your moment to engage. Because when a sitting president says, "I'm facing this, and you should too," it's not just news. It's a call to arms. Let's take a step back and talk about the disease itself. Prostate cancer is one of the most common cancers in men, particularly affecting those over 50. But despite its prevalence, it's also one of the least talked about. And that silence can be deadly. So, what exactly is prostate cancer? The prostate is a small gland, about the size of a walnut, located below the bladder in men. It plays a key role in producing the fluid that nourishes and transports sperm. Prostate cancer occurs when cells in this gland grow uncontrollably. While some forms are slow-growing and pose minimal risk, others are aggressive and life-threatening. The tricky part? Most early-stage prostate cancers show no symptoms at all. That's why regular screening is essential. Because by the time symptoms like difficulty urinating, blood in the urine, or pelvic discomfort show up, the cancer might already be advanced. This is why Biden's diagnosis, made public, serves as a massive wake-up call. Early detection saves lives, but only if you're checking in time. Now, let's talk about how doctors detect it. The most common screening tool is the PSA test, a simple blood test that measures the level of prostate-specific antigen. Higher than normal levels can indicate cancer, though they can also point to other conditions like inflammation or an enlarged prostate. There's also the digital rectal exam, DRE, which allows doctors to physically feel the prostate for abnormalities. Unfortunately, many men skip these tests because of stigma, discomfort, or simply not knowing they need to do them. That's why public figures speaking openly can break the cycle of avoidance. Biden's diagnosis puts the PSA test in a national spotlight, urging men across America to ask their doctors, "Should I get screened?" And here's the good news, prostate cancer, when caught early, has a very high survival rate. According to the American Cancer Society, the 5-year relative survival rate for localized or regional prostate cancer is nearly 100%. The problem is that too many men catch it late. Let that sink in, 100% survival rate if caught early. It's not just about living longer. It's about living better. Avoiding invasive treatments, preserving your energy and confidence, and staying active for your loved ones. That's the power of awareness. And if you're worried about cost or access, know this, more insurance companies are beginning to cover PSA screenings, especially for men over 50, and community clinics often offer them for free or low cost during awareness months. So the big question becomes, why wouldn't you get screened? This is about taking charge. It's about stepping up. Not just because the president did it, but because your life matters too. Let's talk honestly about something that doesn't get said enough. Men's health is often ignored. Not just by society, but by men themselves. For decades, there's been this unspoken belief that real men don't complain. They tough it out. They work through the pain. They stay silent, even when their body is sending red flags. But this mindset, it's dangerous. And it's costing lives. Statistically, men are far less likely than women to go for regular checkups, discuss mental or physical symptoms with their doctors, or seek preventive care. Whether it's pride, fear, or just not wanting to bother anyone, men often wait until something is seriously wrong before they take action. And when it comes to diseases like prostate cancer, this delay can be deadly. This is where public figures, like President Biden, play an unexpected but powerful role. When someone in the spotlight talks openly about their health struggles, it sends a strong message: it's okay to pay attention to your body. It's okay to ask questions. It's okay to take care of yourself. Think about it. If the leader of the free world can speak about prostate cancer, get screened, and pursue treatment publicly, what excuse does anyone else have? What we're seeing now is the slow but real shift in the culture of men's health. More awareness campaigns. More honest conversations. More emphasis on prevention rather than reaction. And the truth is, this shift couldn't come soon enough. According to the CDC, American men have a life expectancy nearly 6 years shorter than women. And a large part of that is due to late diagnosis of preventable or treatable conditions. It's time to change that. And it starts with normalizing these conversations. Let's remove the shame and the stigma. Let's teach our sons, fathers, brothers, and partners that strength isn't in silence. It's in action. Let's encourage regular checkups, honest dialogue, and open ears. When public figures take that step first, it makes the rest of us feel like we can too. President Biden's diagnosis may be personal, but its impact is national. It's a signal that the tide is turning. So if you've been putting off a checkup, if you've ignored a weird symptom, or just haven't had a health conversation in years, maybe this is the moment. Maybe this is your wake-up call. Because being strong means being smart. And part of being smart is staying healthy. When news broke about President Joe Biden's prostate cancer diagnosis, the reactions were immediate and powerful. Some people responded with genuine concern for his health. Others questioned what this would mean for the stability of the White House. And many, especially men over 60, felt a personal connection to the story. But here's what made this moment especially significant: it wasn't hidden. It wasn't downplayed. It was addressed, openly and publicly. That transparency sent a ripple across the nation. For decades, U.S. presidents have walked a tightrope when it comes to sharing their health status. Some downplayed or even hid serious diagnoses to appear strong and capable. Think of Franklin D. Roosevelt's polio or JFK's Addison's disease, both largely hidden during their time in office. But Biden's team did the opposite. They issued a formal statement, clearly outlined the treatment plan, and made it known that this was a manageable condition being monitored by professionals. This open approach served a larger purpose. It told millions of Americans, especially older men, that getting diagnosed isn't the end of the world. It's the beginning of taking control. Now, was there political fallout? Of course, some critics tried to use it to question his capacity to serve. In today's polarized world, even a routine health update becomes a political weapon. But for every skeptical headline, there were thousands of people quietly appreciating the honesty. It helped destigmatize something that affects so many. And the bigger picture? This moment had power beyond politics. It sparked national conversations on men's health. Doctors saw increased inquiries about prostate screenings. Media outlets began highlighting the importance of preventive healthcare for older men. Advocacy groups found a new opportunity to push for policy changes, and people listened. Suddenly, the president's personal health became a public health moment. That's the kind of influence public figures can have when they lead with transparency and vulnerability. Not because they're trying to be role models, but because they're human. And when humans share struggles, we relate, we reflect, and sometimes, we act. This isn't just about President Biden. It's about normalizing health conversations for every man sitting at home thinking, maybe I should finally get that checkup. So yes, the political world reacted in predictable ways. But the cultural impact? That's the real headline. Because for every sarcastic tweet or media jab, there were thousands of men finally booking that appointment they've put off for years. Let's step back from politics for a moment and take a clear-eyed look at what prostate cancer actually looks like in America right now. It's a disease that affects 1 in 8 men during their lifetime. For men over 60, that risk increases significantly. In fact, the average age of diagnosis is about 66 years old, meaning this isn't just a statistic, it's a reality for millions of fathers, grandfathers, husbands, and brothers across the country. Now here's the twist: despite being one of the most common cancers in men, prostate cancer is also one of the most treatable, if caught early. That's the catch. You see, early-stage prostate cancer usually has no symptoms. You feel fine. Life feels normal. Which is exactly why so many men ignore the idea of screening. It's out of sight, out of mind, until it's too late. Let's talk numbers. According to the American Cancer Society, around 288,000 new cases of prostate cancer will be diagnosed in the U.S. this year. Of those, nearly 35,000 men will die from the disease. That's almost 100 men every single day. And yet, screening rates remain lower than they should be. Why? Because prostate cancer is wrapped in silence. There's still stigma. There's still fear. And for some men, there's still a reluctance to talk about anything that makes them feel vulnerable, especially when it has to do with masculinity, aging, or sexuality. That's why Joe Biden's diagnosis matters. Because when the President of the United States shares a health challenge that affects millions of men, it chips away at the silence. Now, the U.S. Preventive Services Task Force currently recommends that men between the ages of 55 and 69 talk to their doctor about PSA testing, which can detect prostate issues early. But here's the thing, too few men are having that conversation. That's where policy and awareness collide. When leaders share their health stories, they don't just influence headlines, they influence habits. And in a country where men are statistically less likely to seek preventive care than women, we need every advantage we can get. So ask yourself, or ask the men you love, when was your last checkup? When did you last discuss prostate health with your doctor? Because the truth is, prostate cancer doesn't care how powerful you are, how fit you feel, or how busy your life is. It only cares about one thing, whether it's detected in time. Public figures, especially those in leadership roles like Joe Biden, have an incredible power to change the way we talk about health, and sometimes, that influence can save lives. Think about it, when a famous person openly shares their health struggles, it shatters the silence around topics that might otherwise be ignored or stigmatized. For men's health, this is a huge deal. Issues like prostate cancer, mental health, or erectile dysfunction often carry a heavy stigma, making many men avoid talking about them, even with their closest friends or family. Joe Biden's announcement about his prostate cancer diagnosis is more than just news. It's a beacon. It sends a message that no one is invincible, no matter how powerful or respected they may be. When public figures share their stories, it creates a ripple effect. Suddenly, the conversation is out in the open, which makes it easier for men to seek help and support without shame or embarrassment. Take, for example, how when celebrities like Chadwick Boseman or Michael Douglas spoke about their cancers, awareness and screening rates went up. The same can happen with political leaders. And here's why that matters: breaking the stigma, men often face social pressure to appear strong and tough. Admitting to health concerns can feel like a weakness. But when the president shows vulnerability, it helps redefine strength. Normalizing screening: if the president can talk about PSA tests and treatments, why can't everyday men? Encouraging family discussions: when a leader talks about a health issue, families start conversations that might otherwise never happen. But it's not just about talk. Public figures can influence policy and funding for men's health initiatives. Their voices can help increase investment in research, improve access to screenings, and support programs that focus on early detection and education. Still, it's important to remember that real change happens only when the message moves beyond headlines and gets into communities. That means healthcare providers, workplaces, and families need to keep the conversation alive, and that's where you come in. Sharing this video, talking to loved ones, or even just asking the right questions at your next doctor's appointment can make a difference. Joe Biden's prostate cancer diagnosis is not just a personal health matter, it has the potential to influence health policy across the entire United States. When the nation's leader faces a serious illness, it often acts as a catalyst for change in how the government approaches that disease. Here's why Biden's diagnosis could be a turning point for men's health policy. First, increased funding for research. Prostate cancer is one of the most common cancers in men, yet many argue it doesn't receive enough attention or funding compared to other diseases. The president's diagnosis puts a spotlight on this issue, potentially driving Congress and health agencies to prioritize prostate cancer research. That means more money for new treatments, earlier detection methods, and better patient support. Second, improved screening guidelines and access. Screening for prostate cancer, especially using the PSA test, has been controversial, with conflicting advice over the years. Public attention can push health organizations to reevaluate and refine their guidelines, encouraging doctors and insurers to make screening more accessible for men over 50 or with risk factors. This can lead to earlier diagnosis, which is key to successful treatment. Third, it could reduce the stigma around men seeking healthcare. Policymakers may support campaigns that encourage men to get regular checkups and speak openly about their health, breaking down the barriers that stop many men from visiting their doctors. Fourth, Biden's diagnosis might also accelerate legislation aimed at cancer care support. Covering everything from affordable treatment to mental health services for patients and families affected by cancer. It highlights the need for holistic care, not just the medical side, but the emotional and social support too. Finally, the president's case can inspire public-private partnerships, bringing together government, nonprofits, and private companies to create programs that reach men in communities that are typically underserved or skeptical of medical care. All of this is possible because the visibility of a high-profile figure like Joe Biden turns the abstract into something real and urgent. When the leader of the free world shares a health journey, it forces policymakers to listen and act. But, as always, policy changes require public support. The more people are informed and vocal, the more pressure there is on leaders to follow through. Awareness is often the first step toward change. Especially when it comes to men's health and prostate cancer. Joe Biden's diagnosis has already sparked conversations across the country, and this kind of visibility can literally save lives. Why? Because many men don't realize how common prostate cancer is, or how crucial early detection can be. When caught early, the survival rate is very high. But without awareness, many men wait too long or avoid screening altogether due to fear, stigma, or misinformation. Increased public discussion helps normalize the topic. When people see a respected figure like the president facing this challenge, it breaks down the idea that prostate cancer is something to hide or ignore. It encourages men to take their health seriously and to seek regular checkups. Awareness also means better understanding of the risk factors, age, family history, race, and lifestyle. For example, African American men are at higher risk, yet often have less access to healthcare. Biden's diagnosis can shine a light on these disparities and push for more targeted education and outreach. Another important aspect is educating about the symptoms and warning signs, things like difficulty urinating, pain in the lower back, or blood in urine or semen. Many men don't know these signs, or they dismiss them as normal aging. Awareness campaigns can change that mindset, prompting earlier doctor visits and testing. Public figures speaking openly about their health can also empower families and communities to support their loved ones. Prostate cancer isn't just an individual fight, it affects partners, children, and friends. Awareness helps create stronger support networks, improving emotional well-being and treatment adherence. Beyond awareness, this visibility can drive demand for better healthcare access. When more people understand the importance of screenings and treatments, they are more likely to advocate for affordable, quality healthcare coverage, something that's often missing for many Americans. Lastly, awareness can boost funding and innovation. The more people talk about prostate cancer, the more pressure there is on governments, nonprofits, and businesses to invest in new research, better diagnostics, and effective therapies. So, the takeaway here is simple but powerful. Awareness leads to early detection, better treatment outcomes, and ultimately saves lives. Public figures have a unique power to influence health behaviors on a massive scale. Joe Biden's prostate cancer diagnosis is a prime example of how one person's story can shift national attitudes toward cancer screening and prevention. When someone in the public eye openly discusses their health struggles, it humanizes the experience and removes stigma. People see that even powerful leaders face vulnerabilities, which makes it easier for everyday men to admit their concerns and take action. Studies have shown that celebrity health disclosures often lead to measurable spikes in screenings. For instance, after Angelina Jolie's public announcement about her BRCA gene and preventive mastectomy, mammogram appointments increased significantly. Similarly, Biden's diagnosis is already encouraging men over 60 to get their prostate-specific antigen, PSA, tests and digital rectal exams, screenings that many had avoided. But beyond the immediate effect on screenings, public influence also shapes health policies. When a high-profile figure's diagnosis makes headlines, lawmakers and health organizations feel pressure to review and potentially expand screening guidelines, funding, and education programs. In Biden's case, this spotlight could accelerate debates about the benefits and risks of prostate cancer screening. PSA testing has been controversial due to concerns about false positives and overtreatment. However, the president's experience may prompt more nuanced discussions and encourage shared decision-making between patients and doctors. Public influence can also help address disparities in healthcare access. Awareness raised by Biden's diagnosis could fuel efforts to improve screening rates in underserved populations, including minorities and rural communities who suffer disproportionately from prostate cancer. Moreover, the media's role in amplifying these stories cannot be overstated. Balanced and accurate coverage helps ensure that the public receives factual information, reducing fear and misinformation. It's important that media outlets avoid sensationalism and instead focus on education and support. In addition, social media platforms give the public a voice, enabling communities to share experiences, offer advice, and build support networks. This democratization of health information is changing the way people approach cancer prevention and care. All these factors combined show how the power of public influence is crucial in shaping men's health trends. Joe Biden's diagnosis may well be a turning point, encouraging millions of men to prioritize their health, seek screenings, and advocate for better healthcare policies. Joe Biden's prostate cancer diagnosis isn't just a personal health matter, it's a wake-up call. A reminder that men's health, especially for those over 60, needs more attention, more conversation, and more action. This moment has the potential to create real change in how men think about their bodies, how society supports preventative care, and how the healthcare system serves aging populations. Let's start with mindset. For decades, many men have been raised to tough it out, ignoring symptoms, skipping checkups, and avoiding vulnerability. Biden's diagnosis, at his age and with his public stature, breaks through that outdated thinking. It shows that strength isn't about hiding pain. It's about facing it head-on, getting the facts, and doing something about it. This shift in perspective can reshape how the next generation of men approaches aging and healthcare. Second, let's talk policy. Health campaigns tied to public figures often lead to funding increases and better policies. We're already seeing a push in Congress to revisit the screening guidelines for prostate cancer, especially for high-risk groups like African American men and those with a family history. If these policies are updated and made more accessible, early detection rates will rise, and lives will be saved. Insurance coverage is another big one. Currently, many insurance plans are inconsistent with covering full screenings unless symptoms are present. Biden's experience could help drive a conversation about expanding preventive care coverage, particularly for seniors on Medicare. This isn't just good healthcare, it's smart economics. Catching cancer early reduces the financial burden of treatment and improves outcomes. We also have to address health education. One of the most effective tools in fighting disease is simply knowing what to look out for. When a major figure like the president is diagnosed, it opens the door for educational campaigns around prostate health, aging, diet, lifestyle choices, and more. Expect to see more resources pushed out through clinics, senior centers, and online platforms. Beyond prostate cancer, this moment can shine a light on men's health in general. Heart disease, diabetes, mental health, these are just a few issues that disproportionately affect older men and often go unspoken. When a national conversation starts, it doesn't stay in one lane. It grows and pulls in other neglected issues. That's the power of visibility. Finally, we can't ignore the role of families and caregivers. Biden's diagnosis gives permission for spouses, children, and friends to start tough conversations with the men in their lives. It's no longer about nagging. It's about love, support, and shared responsibility. So where do we go from here? That's up to us. Moments like these don't just pass. They shape how we think, how we act, and what we choose to do next. Joe Biden's prostate cancer diagnosis may fade from the headlines, but what it sparks could leave a lasting legacy, not only for his presidency, but for the millions of men across the country who finally start taking their health seriously. So, how do we turn this moment into momentum? First, we must continue the conversation. Prostate cancer isn't a one-time news story, it's a daily reality for thousands of families. That's why public awareness matters. The more we normalize talking about prostate exams, PSA screenings, and male-specific health issues, the less fear and stigma men will feel. Awareness campaigns should focus not just on fear, but on empowerment, highlighting survivor stories, accessible resources, and real talk about the emotional and physical journey. Second, we need real action from the healthcare system. Biden's diagnosis could be a catalyst for change in how doctors and clinics approach older male patients. Routine checkups should include clear discussions about prostate health, especially for those over 50. That means training providers, building better guidelines, and ensuring that no man walks out of a clinic without understanding the importance of screening. But it doesn't stop there. The workplace is another powerful avenue. Men spend a significant portion of their lives at work, and employers can play a role in encouraging screenings and healthy behaviors. Wellness programs, health fairs, and insurance incentives are all tools companies can use. Imagine a culture where your boss doesn't just care about your deadlines, but also about your next doctor's appointment. That's the kind of shift we need. Schools and families can plant the seeds early. Young boys should grow up learning that health is strength, not weakness. Biden's example, and the national response to it, can help shape this message in homes, classrooms, and communities. And lastly, let's not underestimate the power of digital communities, just like this one. Platforms like YouTube, where you're watching this now, have become powerful places to learn, share, and inspire action. If this video helped you better understand prostate cancer, or sparked a thought about your own health, we encourage you to share it. It might be just what someone else needs to take the first step. So here's your moment. Ask your doctor the tough questions. Schedule the appointment you've been avoiding. Talk to your brother, your dad, your friend. Change starts with a single decision, and a single voice. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today, and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to speak up. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video. you.